Okay, well, welcome as you're popping on. We appreciate it. Good morning or good afternoon, wherever you are in the country. Thank you for joining us. I am Dr. Susan Reinhardt. You see our pictures up there, or just Susan, Senior Vice President and Director of the AARP Public Policy Institute. And you can see it, Chief Strategist, Center to Champion Nursing in America and Family Caregiver Initiatives. And with me is my lovely colleague, Dr. Ashley Darcy Mahoney. She is a senior nurse scholar in residence at Robert Wood Johnson Foundation and professor at George Washington University, recently promoted to professor, I think, Ashley, congratulations. And Sarah Delgado, who is Dr. Sarah Delgado, Strategic Advisory Clinical Practice Specialist at the American Association of Critical Care Nurses. So I want to thank you all for taking the time to join us for today's webinar about the 2024 Health Equity and Nursing Innovations Funds. This isn't the first set of innovation funds we have done, but it's pretty exciting and it's our most recent one. So our focus this year is on nursing workforce and healthy environments. This request for proposal seeks innovative solutions that create systemic change, strengthen and diversify the nursing workforce, expand nurse recruitment and retention strategies, and create and sustain healthy work environments. I know it's a lot, but it's what we have to do. This opportunity is made possible by AARP, AACN Critical Care, and the Future of Nursing Campaign for Action, which is an initiative of the AARP Foundation, AARP, and the Robert Wood Johnson Foundation. We're going to get into the details around this proposal in a few minutes, but first, a few housekeeping details. This is being recorded, so you will be able to have it available on the Campaign for Action website and share it with others or let people know to go watch it. Please use the chat function to share ideas. We're all kind of used to that. You can make comments there, ask questions throughout the call. During the designated Q&A time, we will answer questions that are posted in the chat, or you may raise your hand. You know that feature, which can be found by clicking on the reactions button, and we will call on you to ask your question. All frequently asked question document will be updated with questions answered today and will continually be updated as we get more questions. And that document can be found on the campaign website. So to ensure the best audio, keep your line on mute and your video off unless you're speaking. I think we all know these rules by now, but gotta say them again. So the next slide this is our agenda today. I'm gonna provide a very brief overview of the AARP Center for Health Equity through Nursing, who is administering these awards. Then Ashley is going to share about the Robert Wood Johnson Foundation and how the National Academy of Medicine report relates to this request for proposals. Then we're going to hear from Sarah, our newest partner here, who will discuss AACN's critical care and the application of their healthy work environment standards and their assessment tool, which are requirements for this RFP. And then I'll briefly cover awards details, eligibility criteria, the application process, and then we'll have time to ask questions. So just a brief overview of the AARP Center for Health Equity through Nursing, or as we refer to it as HN. This is a vehicle for change and a national resource center for advancing health equity. We stimulate, promote, and replicate actionable solutions that eliminate disparities and create better opportunities for people to live their healthiest lives possible. HN leverages the powerful forces of nursing, consumers, remember AARP is a consumer-based organization, AARP, and multi-sector partnerships for sustainable change across the country on 3 priorities. And you can see them there: improving access to quality care, services and benefits for consumers and family caregivers, strengthening and diversifying the nursing workforce, and expanding and engaging state, local, and national networks for collective impact. The next one. HN is the sort of the umbrella, I call it. It houses the Center to Champion Nursing in America, which again has funding from the Robert Wood Johnson Foundation. The AARP Center for Health Equity was created to be very broad. We can have other funding, which you'll hear about more in a moment. And we do run the Campaign for Action, which you know is an initiative, as I already said. We have as the network, you can see these core programs. I mentioned the Campaign for Action. We've had innovation grants over the years. We have mentoring initiatives that Winifred Quinn, who is on, has been advancing for quite some time, career progression. We've had summits and technical assistance. But the network I wanted to point to We have the National Champions Coalition. We have like 2,000 people in our coalition, I guess, across the country at both the national and the state level. We have state action coalitions in most of the states. They have been with us since the beginning of the campaign, and they continue to get new leadership. So succession planning has been very helpful. We have a brand new area, which is the ambassadors, AARP volunteers. These are people at very senior levels. And Karen Drinkard, who's on line with me, really introduced this to us. And so we're pretty excited about that. But nurses, we have AARP volunteers. We have over 1 million members of AARP. We have 38 million members, and 1 million of them, more than 1 million, are nurses. So they're very interested through different outreach we've done to volunteer. And we have various advisory groups. So let me just turn this over to you, Ashley. There we go.
Talking to myself. Thank you so much, Susan. I'm glad to be here with you all. So I'm going to provide a brief overview about really where this grant idea came from, and shout out to Karen Drinkard and the team at the Campaign for Action for really putting on an incredible summit. Maybe about a year ago now, I might not have my exact timing right, but really where they brought together a cohort of really incredible folks in nursing, leaders and practicing clinicians to really talk about and dig into this idea of what it means to have a healthy and robust workforce that can ably take care of the people and in our communities, both in the hospital and outside of the hospital. So as you all know, the Future of Nursing report, Charting a Path to Achieve Health Equity, came out in May 2021. And part of this report really focused on the fact that the United States cannot fully thrive until everyone, no matter who they are, where they live, or how much money they make, can live their healthiest life possible. And promoting health and well-being has long been an essential role for nurses. As the largest segment of the healthcare workforce, we are bridge builders, we're collaborators, and we connect with people and communities to ensure everyone can have an access to being healthy and well. And part of what the report talked about was really a number of different things. When I give my sort of what do you have to know in the 500 pages of the report in a really quick time frame, it's that in order for nurses to advance the health and well-being and advance health equity in the United States, we need support from systems that educate, pay, employ, and enable nurses to do this work. And there are 4 key actions that the report lays out. We have to remove barriers, value nurses' contributions, prepare nurses to advance health equity, and diversify the nursing workforce. And in order to do many of these things, nurses have to be in an environment where they want to be. Number one, we have to practice in an environment that feels like a place where we are valued. It is an environment where we can actually do the work and the care for patients that we are trained and educated to do. And that right now we know that a lot of people are leaving environments because they are not in a place to do that right now, or not comfortable in a place to do that. We also need to have a discussion about nurse well-being and what it means to be well, and how this is a systems problem and not something we can put in a resiliency webinar. That it's not about the individual being resilient, but the system with which they are in to help nurses to be in an environment that fosters nurse well-being. And I think the pandemic has reinforced much of this, that we need to be able to ensure that when we talk about nursing and when we talk about what it means to be in an environment where nurses can optimally practice to the highest level of their ability and capabilities, that the environment with which where they practice is important. There's lots of discussion, and I'm sure we'll have some of it here, about the nursing shortage, nursing vacancies, and all of the things that come around it. But ensuring we have a workforce for advancing health equity is the biggest component of this grant. It can be done, I think, in a number of ways that we'll talk about here. But it all leads to this vision from the Future of Nursing report that the achievement of health equity in the United States should be built on strengthening nursing capacity and expertise. But we have to have nurses to do that work in an environment where they're comfortable and where their wellness is also put in the forefront. So I think I'll wrap with that, but that is where this has come from and the sort of history behind this.
Thank you so much. That was really very helpful and very such your time. Thank you so much. So now we want to turn to Sarah. So Sarah is going to talk a little bit about the AACN critical care and their healthy work environment standards and the assessment tool. Sarah?
Thank you, Susan. And as Ashley emphasized, the environment in which nurses work is essential to our ability to advance health equity. And that makes this partnership between the Future of Nursing Campaign, AARP, and AACN a perfect match, because our top advocacy priority at AACN Critical Care is the health of the work environment. A little bit of background about AACN. We're the world's largest specialty nursing organization. We have a little over 130,000 members. And our vision is a healthcare system that is a healthcare system driven by the needs of patients and families, where we make our optimal contribution as nurses. Next slide. In 2005, AACN published the standards for establishing and sustaining healthy work environments. Those standards were reevaluated and republished in 2016. So they are an example of evidence-based practice. It's sounds like when you read them, like these might be things that are nice to do, but they're actually evidence-based practice to ensure well-being of nurses, as well as better outcomes for patients. In addition to offering resources
Sarah,
about
we
the
can't
standards.
hear you.
Oh, no.
I can hear
Just want to
her.
let you know that.
Jen, I hear her.
Oh,
I can hear.
go ahead. Sorry to interrupt.
I can hear.
Headquarters.
Any other issues with sound? Maybe people can post in the chat if you're having sound issues. I see Taya is putting a thumbs up, so I'm assuming that she's good. Okay. Thank you, Chelsea. Okay, I'll keep going then. So we have 6 standards for establishing and sustaining healthy work environments. They are evidence-based practice, as I said. In addition to offering tools and resources about the standards and to help with implementation of the standards, AACN conducts periodic surveys, national surveys of our nurses to determine the health of the work environment. These surveys focus on acute and critical care, which is our population of focus. However, the standards themselves can be applied in any setting. They're not specific to acute and critical care. In our surveys, you can see, can we go back to the other slide? Because I just want to describe that chart real quick. You can see in the chart on the left-hand side, can we go back one? No. Okay. Well, if you take a look at the slides when they're posted online, in the graphic on the prior slide, you'll see the trend in our national surveys, and we saw a slight uptick meaning an increase in the health of the work environment in 2018, and then in 2021, that progress was lost, and in fact, work environments were less healthy. So it just demonstrates the urgency of addressing the health of the work environment. We also know from our national surveys that nurses working in units that are actively engaged in implementing the standards report less intent to leave, less moral distress, higher quality of care, and a higher percentage of shifts with appropriate staffing. So as I said, these standards are evidence-based. They make a difference for patients and nurses. A key tool that everyone who is awarded a grant will become familiar with is our Healthy Work Environment Assessment tool that this slide describes. So we sometimes call it the HWE for short. This assessment tool is offered on our website. It is free. And you do not have to be a member of AACN to use the tool. You just need one member of your team to set up an account with a valid email address, and then they will create a unique link to share with all the members of their team. Everyone on the team goes into that link and completes the survey. There are 24 items total. It takes about 15 minutes to complete it. All the results are anonymous, completely confidential. At the end of the survey, so the person who sets up the survey establishes an end date. When that date arrives, a report is generated about the results, and you can see an example of the report on the slide here. You can see it points to specific standards that may be stronger and specific standards that may be weaker, and that allows you to sort of target your approach. We've asked that folks who are awarded grants complete the HWEET tool at the beginning of the project and at the end of the project in order to track the impact on the health of the work environment. If you have questions about using the HWEET, AACN offers an email address for sending those questions. And I'll hand it back to you, Susan.
Thank you, Sarah. So I'm sure people have been waiting to get more of the details about these awards. I just want to be very clear that the funding for this Innovation Fund grant opportunities is coming from Robert Wood Johnson Foundation, quite a bit from AARP itself, and from AACN. So this is the first time we've had like an additional partner, and we're just delighted, Sarah, with your organization for joining us. Thank you so much. I also want to point out that you don't have to be in critical care. I should have said that sooner, right, Sarah, that we're looking for healthy work environments, whatever environment that you may be working in. And this tool can be used in any. Do you want to say anything about that, Sarah?
Yes, that's absolutely correct. The standards apply to all settings and the tool can be used in all settings. The existing tool uses language specific to nurses or asks questions with nurses, but we're in the process of updating that so that it has an interprofessional arm. So the tool will be usable regardless of what setting you are in.
Okay, thank you so much. So just a little bit more about the award details. Here you go. The awards are up to $25,000. Oh, you're doing the eligibility first? There we go. 1-year projects that start July 1st. So it's fairly, you have some time to apply for this and be selected. These are awards of up to $25,000 a piece with a 1-to-1 match required for each dollar awarded. In-kind donations do not count as a matching fund. So this is a little different than we've done in the past. Sometimes we've done it like this and sometimes we haven't. So we're back to requiring a 1-to-1 match. Next. And these are the eligibility criteria I read. The first one before, to offer innovation solutions that create systemic change. So we're looking for systemic change, not one-offs. Strengthen and diversify the nursing workforce, expand innovative nurse recruitment and retention strategies, and create and sustain healthy work environments. So that's exactly what I said at the beginning. And again, as you heard from Ashley, support the advancement of 1 or more recommendations from the Future of Nursing 2020-2030, charting a path to health equity. You'll need to describe how the project will implement 1 or more of the AACN critical care standards that you just heard from Sarah, standards for establishing and sustaining healthy work environments. And you'll confirm the project will use what you just heard about, the AACN critical care's HWEAT as a pre and post measure. Healthy work environment. You'll need to clearly explain the role of each partner identified for this project, show evidence of diverse and genuine community partnerships, describe how the following outcomes will be impacted, monitored, and evaluated during this 1-year timeframe. The number of nurses that are impacted by the program or project over the grant period, the retention of RNs as indicated by RN vacancy and turnover rates in the care setting. Again, doesn't have to be critical care, doesn't have to be hospital, at both the beginning and the end of the project, and the change in those scores. So you need to secure the 1-to-1 matching funds. There'll probably be questions. Do you have to have that letter of agreement before you apply? So I'm going to have Jen Pete answer that question because I know it'll be asked. Preference will be given to applicants that are either public entities or tax-exempt nonprofit organizations under Section 501c3 of the U.S. Internal Revenue Code. That doesn't mean we won't think of others, but we do give preference to nonprofits. And applications submitted by a Campaign for Action State Action Coalition or an approved organization affiliated with the State Action Coalition will be viewed more favorably. It's not a requirement, but it will get you extra points. The action coalitions in almost every state, as I said, in Washington, D.C. If you are in a state that doesn't have one, just let us know. And we can let you know. We can certainly, it's on our website where they are and who they are that you can contact. Again, within these coalitions, they're comprised of nearly 2,000 local, regional, and state-based organizations. And we keep track of how much money the action coalitions have been able to raise on their own outside of funding from AARP or from the Robert Wood Johnson Foundation. Together, they've raised over $130 million over the years. So the state action coalitions have been incredibly successful at attracting funding. Next. I think, and so who should you collaborate with? So non-nursing community partners, partners that have a proven track record of implementing solutions or similar goals, and certainly through us, and we have a very robust nursing network. Okay, I think we're ready for questions. Oh, there you go, how to apply. Application deadline is April 5th by 10 p.m. Eastern time. They should be submitted via email, and there is the email address, nursinginnovations@aarp.org. The RFP application and frequently asked questions can be found on the Campaign for Action website, which is H2, or you can see it, campaignforaction.org/2024-innovations-fund. All funding decisions will be made by a review team consisting of ARP and AAC and critical care leadership, staff, and advisors. So here are the questions or comments, and I am going to turn this over to Jen Pete. And I hope she can hear her. She's the one who said she couldn't hear.
I can.
Okay, good.
Oh, we got to adjust something. Hold on. Okay, good. There we go. No feedback. Thank you. Thank you, Susan and Sarah and Ashley. That was fantastic. There's a few questions in the chat. I guess we'll start with that. And Sarah, I think they're all for you. The first one is it possible to add demographics or other questions to the link for the tool for the applicant's purposes?
So there is not an option to add questions to the existing tool. The tool collects us. It's a psychometrically tested tool, so it's not something that can be changed or adjusted. It has specific questions in it. You can see a list of what those questions are at the link that I put in, the most recent link that I put in. So you can see what the questions are that are asked, but they can't be changed or added to.
Okay, great. Thank you. And then in a similar question, Cynthia Bienemy asks, does the tool capture information about racism in the work environment?
The tool does not ask specifically about racism. It asks about how the environment is, the health of the work environment across the 6 standards. So it would identify issues with, say, collaboration or effective decision-making that could indicate, that could well result from implicit or explicit bias in the workplace. So it would more be focusing on the specific behaviors, actions, and the context of care than it would be on racism as a single entity. Does that make sense? I think it's going to depend on what you're going to get is a report that tells you what the strengths and opportunities are in relation to the 6 standards. And then within the context of the project, think about what interventions would improve the areas that are scoring lower. So it's going to relate to addressing racism or bias in that way.
Cynthia, does that answer your question? We'll see. You can
Yeah.
Go ahead.
Hi. Yes, it does. It does. It's just that sometimes that especially looking at the ANA report on racism within the nursing workforce and its impact and some of the conversations that we've had, that I was thinking that that's probably a very important component of the workplace environment. Thank you.
It certainly is.
Mhm. Okay, and I think to build on this, Karen, I'm gonna lean on you too. I mean, there are opportunities to address structural racism within the healthcare system as you're working on the environment, right? Even though the tool doesn't necessarily assess for that.
Well, and Cynthia, I would say if you had other data that you recognize, it may be some additional data that you want to include in your project.
Thank you. That's helpful. Thank you.
Are there other questions?
Sorry, we were having some tech issues here.
Oh, okay.
We lost sound for a second. I'm
Okay.
gonna switch over to Pat Patrician. I see your hand up. Go ahead, Pat.
Yeah, thank you.
I can't hear.
Thank you for this opportunity.
Here.
I
Oh, come on.
was wondering a few things. Oh, yeah, I hear an echo. Number one, for the Healthy Work Environment instrument, is it possible for us to also, I know you want us to use it on your platform, but could we also, if we wanted to test it against some other instruments, could we also like copy over the questions onto Qualtrics and use it in that way as well?
Sarah?
We can explore doing that. We have done that in another circumstance, so I think it's worth looking into doing that. The thing we wouldn't be able to offer is the automated report, if that
Right, I
was
mean,
done, if that
we
makes
would-
sense. So
Oh,
so you
absolutely.
would get your report through Qualtrics if
Uh-huh.
that was the strategy you used.
Right. Okay. And another thing, I was reading the criteria for applying and all that. And, you know, we have another grant right now where we're doing well-being interventions for the hospital, the school, the faculty in the school, the students, and also some of the rural hospitals in our state. Is it okay to include several different sites in this particular grant, or would you rather have us sticking to one place with our intervention or interventions?
I'm just gonna pop in here, but Sarah and Ashley, I think multiple sites would be fine.
Okay,
Ashley, Sarah?
Think it's fine with me. It's just a small amount of money. So I think it just
Right.
depends on how you can do the work and ensure impact with the funding that's available.
okay. And when would the decisions be made on the funding? How many grants would be funded? And when would the money be available?
Okay, Jen, can you answer those questions?
Sure. Oops. I don't know where that's coming from.
No, you're on. We can hear you.
Okay, great. Sorry for the tech problems in the room. The projects begin July 1st. Finalists will be notified in June, late May or June, and the funding will be in place for the awards to start.
And how
Was
many?
that all
will
your
be
questions,
fund-
Pat?
How many will be funded? I'm sorry.
Yeah, we can't hear.
How many will be funded?
Karen, can you just mute everything?
Jen, Pat is
Okay.
asking how many will be funded.
Right now, we envision up to 12.
Okay, just want to
We'll
know
have
what the
to see.
chances are.
Right.
Good,
Always a good question.
question. There's one other question while we're on funding. The one-to-one match will need to be matched by our organization, right? That comes from Aaron. That's no, not exactly. You could get matching funds from other partners. It just needs to be cash, you know, 25,000 or as much as you're applying for. In-kind donations are not counted as matching funds.
Jennifer, what do they have to have in hand at the application point themselves? Do they need a letter from matching? Or, okay, because that was asked too, and that's what I wanted you to address. So
Yes,
it's not that they have the money, but they have a letter of commitment.
correct, which is considered a pledge, which is just as financially good as having cash in hand. So it's got to be a letter of commitment that says the dollar amount, the purpose, and the date that they will give you the funds.
Okay.
I'll turn to Liz Hayden, hand up. You're on mute, Liz.
Sorry, I was unable to unmute myself. Thank you. So that was my question about the matching funds. So if it's our own organization, then we would just provide the letter saying that we would supply the match out of our operating budgets, amount and date available and all of that. Is that correct?
Yes.
And then a second question, is the focus entirely on RNs, or can the focus also be on nurse practitioners or?
So Karen? You just turn it off, Karen. Turn yours off. Karen's here with me. I'll just turn my computer to Karen.
Sorry. No, we are happy to see any nurses involved in the grant process. So all RNs and nurse practitioners are, so that would be great.
Thank you. And the last question that I have is that it doesn't sound like the setting is restricted either.
That's right.
So residential treatment, outpatient.
Yes. Yes.
Psychiatric, that any kind of setting is
Absolutely
acceptable.
And I'm glad you asked that question because I keep wanting to point it out. So thank you again, Liz.
And the focus on any population. Example, we serve a special population across most of our services. And
absolutely.
Then my final question is, we have a system of care with multiple organizations that all partner together as related affiliates in different states. So that sounds like that would be acceptable to have potentially nurses from across our system of care in multiple places.
Yes.
Whatever intervention that we could put in place to help.
Yes.
Health and wellness would be acceptable.
Yes.
Awesome. Thank you so much. I appreciate it.
You're welcome.
And I just want to interject too. Thanks so much for all these questions, Liz. In addition to like the sort of health and wellness part, right? It's really thinking about too, like, is there more to what's happening in your system beyond just like the sort of health and wellness of the nurse? Things like staffing, policies, right, et cetera, et cetera, et cetera.
Growth and education and promotion. And
exactly, right? I don't want to just like limit us to just thinking about like health and well-being in just one way, but like a broader context too.
Thank you.
So Marion Lynch, I see your hand is up. You're on mute still, Marion. On the bottom left is the mute button. So Marion did ask in the chat also if this is limited to the United States or international. This is a United States initiative.
Yes.
And
Hey, Jen?
Yes, Wynn?
Okay. Marion said that was her question. I did chat on the side with Shirley Giroud, and I did encourage her to bring it forth, but I haven't seen her restate her idea yet. And I think it's an idea worth sharing. And that is the where she asked about engaging government, various levels of government. It was really engaging a level of government as a potential partner, not even necessarily a funder. And I said, I really like that idea. Would a state government be able to be nimble enough, right, as with the grant? But it's a possibility. It's a possibility. So,
yep.
And there's Shirley. Shirley.
Hi, Shirley.
I was just going to say, I put that in for a broader reason, but there are a number of states that have coalitions that have projects that are going on already. So they may be able to tag some of that money for this initiative. But what I was putting in there was there are things that the broader coalition, the Future of Nursing Campaign for Action, has done that we might want to get out there to state policymakers. And I do consulting work for the Council of State Governments East. And so there's an
lost her again.
opportunity, if you have things that you think we want to share more broadly with state governments, just let me know and I can post those up.
Oh,
So-
that's great, Shirley. Thank you.
Shirley, you're welcome to, I'll put my email in the chat. You're welcome to email me your suggestion and we could explore that possibility.
Okay, thanks.
Great, thanks.
There's a few more questions in the chat now. What is the term for the grant? When do grantees need to provide results reports? It's a 1-year project, so it's July 1 to June 30th. And then we give you a template to report out on within 60 days of the close of the grant. And it's just on the impact of the grant. There's generally not a financial report required with this initiative. Let's see. Will diversifying the workforce be emphasized in the submission? Lena, can you say a little more about your question? I'm not following it.
I'm sorry, for some reason I thought this grant submission was also about diversifying the workforce, and I don't know. I think I'm not getting this.
It is.
I need some sort of understanding. For some reason, I thought it was under diversifying the nurse workforce, and I'm hearing a lot about the pre and post surveys and all of that, but
Lena,
it's a
maybe,
little confusing right now.
yeah, Lena, thanks so much for your question. I am wondering also if maybe she was referring to the previous call for the innovation funds. So I'll ask Jen that question, but then I'll maybe answer this. I think if there's a way in which you can tie diversifying the nursing workforce and some of the really awesome work you do, which I'm super familiar with, to creating an environment where nurses can practice health equity, right, in a better way, then certainly there is a link to doing that. This focus of this innovation fund was on building a workforce to advance health equity, or ensuring we have one. So I think there's a way to do it, but I'm wondering if maybe there's also the previous innovation fund that we're thinking of here too. Maybe I'm wrong, just throwing that out there.
Yeah.
Okay, thank you.
Thank you, Ashley and Lena. That was a great question. Lena, you're welcome to call us and we can walk you through what you're thinking. And we definitely see this initiative as a way to help strengthen and diversify the nursing workforce, as well as workforce retention and recruitment. So we see the alignment, but if you want some more, we can talk and we can put you in place with some nurse experts here that help create the call that can help you too.
Thank you so much.
So Deb Elliott asks if we can apply grant funding to RN nursing students as well as practicing RNs. I think if you can be creative in that space, but remember the metrics here are tied to vacancy rates and turnover rates. So I'll leave that to you, Deb. I know you're super creative, but it's got to be focused on the metrics. What about long-term care, CNAs and LPNs? Susan, I'll turn to you. Your head's nodding.
I was thinking, as we were saying, when someone asked about nurse practitioners, I guess, and interprofessional and those kinds of things. I mean, we actually have a focus on LPNs trying to help them move through the career journey if they so choose to become RNs. So we're particularly interested in that, but I don't know what you have in mind. This is less about nurses' aides, though. And frankly, trying to attract and retain registered nurses in long-term care is a huge issue. So I would hope that you could focus more on that and perhaps the LPNs.
Yeah, I will say that the Future of Nursing report does talk about nursing at all levels, and that is a really important component of the Future of Nursing report in this case. I think the Future of Nursing report in 2010 really had a large focus on the APRN group in terms of ensuring access to care and reducing the barriers to access to care. This Future of Nursing report really did focus on nurses at all levels of care.
Not including nurses' aides, though.
Right.
I just want to make that clear since I brought that up.
I mean, it doesn't make that specification, but
Yeah.
yes.
Right.
Licensed nurse.
I do see Brandy. Brandy's asking, what are the eligible uses for the funding itself? That's a really open-ended question. Brandy, can you jump on the line and maybe narrow down your question a little bit? We do have clarity in the RFP what's disallowed, such as lobbying is not allowed. Renovating a building, so to speak, and like those sorts of investments.
So my answer is if it's not in that area that you can look at that, then it's a go. And if you have any questions, then you should call us. Does that make sense?
Let's see, does anyone else have their hand up? Sure.
Randy, are you there?
She says you all cannot hear me.
Well, Brandy, if you want to give us a call.
And I know Nicole added some more.
And you have a question, we'll update it on the FAQs so everyone can benefit from it.
Jennifer, can you hear me?
Yes.
Oh, okay, good. Because I just want to point out that Nicole added some more in the chat to answer that question.
Randy just responded to it as well. She was wondering about personnel fringe. Yep, I just posted.
Okay. I think that's all the questions I can see in the chat. Oh, maybe there's 3 more. So
Jen,
Brandy, I see you're saying personnel, fringe, supplies, things like that. It's all in the RFP. And in the application, there's a budget template that shows the limitations on overhead, on indirects.
Thank you. Thanks, Robin. Okay, I think we've answered as many questions as is raised. We have over 50 people. Some of those numbers are us, I realize, but that's a really good number of people. Please feel that you can pass on this call. It's on our website, and let people know that this is available. There's time to apply. It's not like next week, so reach out to some partners that you feel you can work with, and hope you apply. Thank you. And thanks to the team. I appreciate it all. And thanks to Ashley and Sarah.
Thank you all.
Good luck.
Bye-bye.
Bye.
Thank you.
Thank you.